You feel overwhelmed, anxious, or maybe depressed. You decide to seek professional help, but then comes the big question. Should you see a psychologist, a psychotherapist, or a psychiatrist? What's the difference? And who is the right person to help you? According to the World Health Organization, 1 in 8 people globally lives with a mental health disorder. Yet many don't seek help simply because they don't know where to start. Today, I'll explain the key differences between these 3 mental health professionals through a quick story, so you'll never be confused again. Let's meet Alex. Alex has been feeling off for months. Some days he's too anxious to leave the house. Other days he feels numb, like nothing matters. He knows he needs help, but when he searches online, he sees the terms psychologist, psychotherapist, and a psychiatrist, and suddenly everything feels confusing. If you've ever felt the same, you're not alone. Many people don't know the difference between these professionals, and that lack of understanding can make it harder to get the right help. So, let's break it down in the simplest way possible. When Alex tells his best friend about his struggles, his friend says, "You should see a psychiatrist." But later, Alex's coworker tells him, "No, you need a psychologist." Then, his cousin suggests a psychotherapist. Now, Alex is more confused than ever. The truth is, all 3 professionals work in mental health, but they serve different roles. Let's imagine Alex goes to see each one of them, so we can clearly understand how they're different. The first is a psychologist. Alex first visits Dr. Michelle, a psychologist. She has a PhD or master's in psychology, which means she has spent years studying human behavior, emotions, and mental processes. She doesn't prescribe medication, but she does therapy, helping people understand their thoughts, emotions, and behaviors. For example, if Alex has anxiety, a psychologist might use cognitive behavioral therapy, or CBT, to help him recognize negative thought patterns and teach him healthier ways to cope. The key takeaway here is that psychologists focus on diagnosing mental health conditions and providing therapy, but they do not prescribe medication. Next, Alex visits a psychotherapist named Lisa. She doesn't necessarily have a higher psychology degree or PhD like Dr. Michelle, but she is trained in mental health therapy techniques. Psychotherapists can come from different backgrounds. Some may even have degrees in psychology, social work, or counseling. Their main focus is helping people through long-term talk therapy. For example, if Alex's struggles come from past trauma, a psychotherapist might use deeper, long-term therapy to explore his childhood and relationships to help him heal over time. The key takeaway here is psychotherapists are trained to provide talk therapy, and while psychologists can also be psychotherapists, not all psychotherapists are psychologists. Next is the psychiatrist. Finally, Alex visits Dr. James, a psychiatrist. Unlike the psychologist and the psychotherapist, Dr. James is a medical doctor. He specializes in diagnosing mental health disorders and can prescribe medication. Psychiatrists often help people with severe conditions like schizophrenia, bipolar disorder, or major depression that might require medication. For example, if Alex's anxiety is caused by a chemical imbalance in his brain, a psychiatrist might prescribe medication like antidepressants or anti-anxiety drugs to help stabilize his mood. The key takeaway here is psychiatrists are medical doctors who focus on mental health and can prescribe medication, unlike psychologists and psychotherapists. Now, Alex understands the differences, but he still wonders, which one should he see first? The answer depends on his needs. If he wants therapy and coping strategies, he should see a psychologist or psychotherapist. If he feels his symptoms are severe and might need medication, he should see a psychiatrist. In many cases, these 3 professionals work together. A psychologist or psychotherapist may refer a patient to a psychiatrist if medication is needed, and a psychiatrist may recommend therapy alongside medication for better results. Most studies found that a combination of therapy and medication is often the most effective treatment for mental health disorders. That's why many people benefit from seeing both a therapist and a psychiatrist. So what have we learned today? A psychologist is trained in diagnosing mental health conditions and providing therapy, but does not prescribe medication. A psychotherapist focuses on long-term talk therapy and can come from different educational backgrounds. A psychiatrist is a medical doctor who can diagnose mental health disorders and prescribe medication. Knowing these differences can help you or someone you care about get the right support. No matter which professional you choose, seeking help is a strong and important step toward better mental health. If this video helped clear up any confusion, drop a comment below and let me know your thoughts. If you know someone who might need this information, share this video with them. And if you're interested in more mental health topics, check out my other videos. Together, we can break the stigma surrounding mental health. See you in my next video.